my name is Julie. I'm going to be your nurse today. How are you doing?
Good.
Today we're going to be doing a thorax, cardiac, and abdomen assessment. Can I get your name and date of birth?
Thad Dudley, 9/13/97.
Great. Okay, so first, looking at your breathing, I see that you're not using any accessory muscles to breathe. I see that you have a regular rate of breathing and no accessory muscles. I don't see that you're out of breath. Looking at your transverse ratio, I see that you're 1 to 2, which is expected. Now I'm going to be checking for tactile fremitus. Turn you this way. Thank you. A little bit. Thank you. Okay, now just say 99.
99. 99. 99.
Great. I felt equal vibration in both sides, which tells me you don't have any consolidation. Now I'm going to be listening to your lungs. Every time you feel my stethoscope, I'm going to ask you to take a deep breath in. Okay, now I'm going to ask you every time you feel my stethoscope to say E.
E. E. E. E. E. E.
Great, I heard E in all 6 areas that I listened to. If I heard A or anything else, that would tell me you also have another consolidation, but I don't hear that you, I hear that you do not. Consolidation would mean some sort of fluid in your lungs. Now, I'm going to be checking for CVA tenderness right under the 12th rib. You should just feel a thud. Let me know if you feel any pain or tenderness. Any pain?
Nope.
Did you feel thud?
Yep.
Great. Now I'll be listening anteriorly. Just going to turn you around. Great. Okay. Oops. Every time you feel my stethoscope, just take a deep breath in. Ask you to lift this arm up. And on the other side. Great. All right, now I'm going to be listening to your carotid artery. I'm going to be listening for any bruits. So I'm going to ask you to hold your breath for just a brief moment. Great. Now I'm going to be listening to your heart and listening to your heart valves. Starting on the right side in the second intercostal space, this is your aortic. And moving on to the left side, this is your pulmonic. And moving down to your third, this is your herbs. And your fourth, this is your tricuspid. And your fifth, this is your mitral. Down here in your fifth is, in the fifth intercostal space where your mitral valve is also the apex of your heart where your S1 the loudest. In your second intercostal space, at the base of the heart, that is where I hear S2 the loudest. Now we are going to, and also I could hear that your pulse and your rate was regular. I didn't hear any irregular rhythms of your heart. Now I'm going to be palpating and grading your pulses, starting with your temporal. Got a grade of 2, and your carotid. 2 or 3, got a 2. Your brachial, about a 2. Your radial, that's about a 3. I'm going to ask you to back up a little bit. You bring that chair back, and then can you bring your feet up onto the bed? Can you do that? Sorry, thank you. Okay. Can you bring your other foot? I'm going to be feeling for your posterior tibialis. About a grade 2, and your dorsal pedis. It's also about a 2. Great, thank you. Now I'm going to be feeling for any heaves or thrills. So, just placing my hand here and here. Don't feel any heaves and thrills. Great. Now, looking on the left side, I don't see any jugular vein distension. And looking at your lower extremities, I don't see any edema or any peripheral edema. Can you bring your feet again if you're, I'm so sorry. Now I'll be checking capillary refill on your toes. I see your capillary refills within 1 second. Tells me you have good perfusion to your lower extremities. If you put your foot down, I'll be checking your hand. Checking capillary refill again. And that was, yep, within 1 second. Good perfusion in your upper extremities as well. So I believe that completes our cardiac and our lung. Now I'm going to ask that you lay down with your head at the top of the bed. We'll be completing our abdomen assessment. First, looking at your abdomen, I don't see that you're protuberant. I don't see any signs of ascites. Now I will be auscultating. Starting with your right lower quadrant. And your right upper quadrant, your left upper quadrant, and your left lower quadrant. Great. Now I will be percussing in each quadrant, and your right lower quadrant, your right upper quadrant, and your left lower quadrant. Great, I heard tympanic snarls, which is expected. Now I'm going to be palpating your abdomen. Do you have any pain or tenderness anywhere?
No.
If you did, I would palpate those last. But please tell me if you do experience any pain while I palpate. Starting with light with one hand and your right lower quadrant. Okay, right upper. Left upper. And your left lower. Did you feel any pain?
No.
Awesome, thank you. Now that I've palpated, we're just about finished. You can sit up now. Do you have any questions for me?
No.
All right, thank you so much. Let me just check one thing right here. All right, sweet. Thank you so much. You've been a great patient. Do you have any questions? No questions?
No questions.
All right, thank you so much. You have a good day.
You too.